Hi, it's Dr. Elisha Van Duzen with New Hope Chiropractic. What is bronchitis? Well, bronchitis is the inflammation of the bronchial tubes, and this condition causes you to cough persistently, sometimes making it really hard to breathe. And the same viruses that give you a cold or the flu will also cause bronchitis as well. So, some signs and symptoms with bronchitis are things like a sore throat, fatigue, a stuffy or runny nose, fever, body aches, vomiting, and also diarrhea. And with acute bronchitis, it's definitely the more common variety, and it typically doesn't cause any problems once the infection is gone. But with chronic bronchitis, it's ongoing. It's a serious condition that's associated with an accelerated decline in lung function. And people with chronic bronchitis have a long-term cough, and they also have mucus. So this is a long-term thing that ends up causing you to cough and causes respiratory distress. So here are some natural remedies for bronchitis. First of all, you want to have an anti-inflammatory and probiotic-rich diet. Anytime you're trying to fight an infection, whether it's a bacterial or a viral infection, you should focus on eating anti-inflammatory foods that'll help strengthen your immune system and reduce internal swelling. So you want to eat plenty of raw fruits and vegetables, which will provide important vitamins and minerals, and also won't produce mucus. Bone broth is another good healing food that'll supply essential vitamins and minerals. It's also helpful to eat probiotic-rich foods because they boost the immune function and replenish the healthy bacteria in the gut, which is necessary if you're on antibiotics especially. Some really good probiotics are things like cultured vegetables, like sauerkraut and kimchi, kombucha, um, cultured yogurt. Those are all good probiotic things. And there's also some things that you should avoid because they're mucus producing, like conventional dairy, sugar, and a lot of fried foods. You also want to stay hydrated. Drink plenty of water throughout the day. It'll help thin the mucus in your bronchial tubes, and that'll decrease the cough and make it easier for you to breathe. So you want to drink a glass of water about every 2 hours or so. Use a humidifier. A humidifier can help loosen mucus and also relieve wheezing and limited airflow. A 2014 study in Value Health suggests that humidification therapy is cost effective and also effective for patients with chronic obstructive pulmonary disease. And you can use one in your bedroom throughout the night until your bronchitis symptoms clear. Also, if you smoke, you should definitely quit as soon as possible. That's a no-brainer. The most important step you can take to reduce your chances of developing bronchitis is to quit. Don't start. Obviously, in the first place, multiple studies have found that the risk of chronic bronchitis goes up significantly in current smokers and people who've never smoked. And research shows that approximately 5 years after quitting, chronic bronchitis risk past smokers approach that of non-smokers. So there's some benefit to stopping smoking, which will put you on par with non-smokers. It's also important to try to avoid secondhand smoke and other lung irritants like dust, vapors, fumes, and air pollution. Also, you want to try pursed lips breathing. People with chronic bronchitis can find it hard to breathe because of restricted airflow in the bronchial tubes. So a breathing technique called pursed lips breathing can be helpful. And according to the COPD Foundation, pursed lips breathing helps to slow your breathing and keeps your airways open, and then your lungs can get rid of more stale, trapped air and reduces the work of breathing and improves the exchange of oxygen and carbon dioxide. It also increases the amount of time you can exercise or do a certain activity, which can normally be difficult otherwise with chronic bronchitis. So to do pursed lips breathing, breathe in through your nose for about 2 seconds, pucker your lips like you're getting ready to blow out a candle, and then breathe out very slowly through pursed lips 2 to 3 times, as long as you breathed in for about 4 seconds. Also, some good supplements to take are N-acetylcysteine or NAC. It helps to decrease the severity and frequency of coughing attacks and improves overall lung function. It does this by increasing glutathione levels and thinning bronchial mucus. And if you supplement with this, you can help to thin the phlegm so that it's easier to cough it out. Echinacea is also very good. one of echinacea's chemical constituents. Actually, a lot of the chemicals in echinacea are powerful immune stimulators, and that can help provide a lot of therapeutic value. Many studies show that echinacea has the ability to fight the common cold with its antiviral properties. This cuts the chances of catching a cold by 58%. It also helps to reduce cold symptoms, which are also common complaints by people suffering with bronchitis. So instead of using over-the-counter meds to try to relieve pain with bronchitis, you can use echinacea to ease a sore throat or headache instead. Vitamin C is good too. It helps to boost the immune system and decreases the severity and duration of colds. You can take 1,000 milligrams of this a day to fight off the cold, or take 4,000 milligrams per day to get rid of a cold that's already in your system. And usually, because bronchitis starts out as a common cold, then you can use vitamin C to address the issue before it becomes a bigger problem. And you can also add vitamin C-rich foods like oranges, kale, kiwi, strawberries, grapefruit, red peppers, green peppers, guava, and broccoli. Astragalus is a root that's one of the most powerful immune-building plants on the planet that can also help strengthen your weak lungs and increase the body's ability to fight infections, but it's usually not recommended with a fever. So astragalus can be a good adjunct therapy for boosting the immune system as well. Ginseng, it's a herbal supplement that can help to improve lung function, and it's therefore used as a common therapy for asthma, and it has the power to decrease lung bacteria and treat chronic obstructive pulmonary disease, or COPD. So it also helps boost your immune response and decrease infection. Eucalyptus oil is another very powerful aid for people with bronchitis. So eucalyptus oil is an essential oil you can take. You can make a steam bath with eucalyptus oil by pouring a cup of boiling water in a bowl and mixing in 10 drops of oil. Then place a towel over your head as you lean over the bowl and inhale deeply for 5 to 10 minutes. You can also apply 2 to 3 drops of the eucalyptus oil and also equal parts of coconut oil directly to the chest, like a vapor rub. Peppermint oil is also very good. It's also a nice cooling sensation and calming effect on the body. It helps with respiratory ailments, helps clear the respiratory tract. You can also relieve chronic symptoms with inhaling peppermint oil directly from the bottle to unclog sinuses. Oregano oil is also good. It's a natural antibacterial agent and it supports bronchial health. It's a natural antibiotic without any harmful side effects. It also has the power to treat viral conditions, reduces inflammation, and it can also, therefore, help with your chronic bronchitis. So these are all things you can do naturally without negative side effects to treat your chronic bronchitis. And of course, a healthy immune system is also vital for protecting your body, and how that can be achieved through a healthy nervous system. So a healthy nervous system is great for boosting your immune response, so you should also get checked chiropractically for spinal subluxations, and that can help as well. So check out our website, newhopechiropractic.com, and we're always there to answer any of your questions. Have a healthy day.